patient in cardiac arrest. A killer heart rhythm called ventricular fibrillation has rendered him unconscious. The lower chambers of his heart are quivering uselessly instead of pumping blood around the body. Every organ is slowly being starved of oxygen. Multiple organ failure is imminent, and he is in danger of sudden cardiac death if his heart is not reset within minutes.
Hij is terug. Peter, het is Benjamin. Ik heb hier een jonge man op de spoed gevallen die net gereanimeerd is met een Brugada EKG. Kom je even langs? Bedankt.
Dr. Pedro Brugada, a renowned cardiologist, has been investigating abnormal rhythms of the heart for over 30 years. He knows the secrets of these sudden unexplained deaths lies not in the pumping function of the heart, but in the electricity behind it.
I was a professor of cardiology in the University of Maastricht in the Netherlands when I was approached in quite an unusual way by a Polish man with his son of 3 years.
Poland, 1986. A young father performs CPR on his son. The situation is critical. Just one mistake and he could lose his son to the same fatal heart rhythm that tragically claimed his daughter 1 year earlier. In a last-ditch effort to save his child, the man leaves Poland to seek help from Dr. Brugada. Alerted by the graveness of the situation, Dr. Brugada takes the boy's electrocardiogram, a simple test known as the ECG that measures the electrical activity of the heart.
That electrocardiogram was a big surprise. It was clearly not normal. There was something that, to be honest, I had never seen before. It was a weird electrocardiogram showing the fin of a shark.
Desperate for answers, Dr. Brugada searches for more information on the peculiar electrical pattern, but he finds nothing.
Some months passed by, we were fighting still to understand what was going on, and then the father decided to go back to Poland. And at that time I asked, can you just get the electrocardiograms of the sister for me? And he did. Turned out to be exactly the same pattern as we saw in the brother.
It is a pivotal discovery. Not only does this disease show a distinct electrocardiogram, but it can also afflict more than one member of the family. After finding 8 patients with the same electrical pattern, Pedro Brugada and his 2 brothers publish their findings. What they describe is a new clinical entity, and one that becomes known around the world as the Brugada syndrome.
It's just like a lightning in a completely blue sky. It comes up at the most unexpected moment, frequently without any warning, so that the family has no chance at all to prevent that sudden cardiac death by bringing that individual to the doctor, doing investigations. There is nothing before that. The first manifestation is frequently sudden cardiac death. 1/3 of them die suddenly without any previous symptoms. And that's a dramatic situation.
With almost nothing for doctors to go on, the race is on to identify people at risk before it's too late. But how? These appear to be perfectly healthy people. Working from his consultation in Brussels University Hospital, Dr. Brugada is examining patients. He knows that the syndrome has a habit of working its way round the family. The first place he looks is the family tree, because more often than not, there has already been an unexplained death there before.
Sad, typical problem of Brugada syndrome in this family, that came to the light, unfortunately, just after the death of the son. It's not the only case. I mean, it's like this. I mean, this disease was not known. It has taken not that many years to get a lot of information. Many patients in the past were not diagnosed simply because the disease was not known.
The diagnosis of the syndrome is easily obtained from the electrocardiogram, as long as the patient presents the typical Brugada pattern.
If you just go and compare to a completely normal electrocardiogram, if I take, for instance, the normal electrocardiogram shows this pattern, and then it's flat, voila. In Brugada syndrome, what we see is that this pattern changes into something like this, goes up, and then comes down like that. You see, this is the baseline, and this is the added feature of Brugada syndrome.
But the disease hides another secret, the trademark shark's fin that has a habit of disappearing. And if another member of the family is diagnosed with the disease, doctors treat this suspiciously. Believing the shark's fin to be in there somewhere, they are left with the challenge of trying to unmask it using special drugs. One of those drugs is Ajmaline.
So here you see almost nothing, and then you see that with the administration of this drug, we go into a typical pattern.
It's a simple procedure, for most. Evelyn de Vos underwent such a test after her mother was diagnosed with Brugada's syndrome, but her own ECG pattern was normal. Her father remembers the day doctors tried to unmask the Brugada sign.
And I never forget the date. It was the 26th of December. And we made a whole schedule of the day. At first we would go to the clinic to do the testing, and we were very assured that everything would be normal. After, I think, 5 minutes after they had injected a part of the Ajmaline, I saw at the electric cardiogram that there was something that wasn't quite right. And at a certain time I looked up, because Evelyn said, "Dad, I'm getting warm." It's hard to explain, but sometimes you see in the movies a flat line. And when you have your child in your hand, and you feel she's looking at you and she says, "Dad," and she takes your hand and you see the flat line. It's really, it's something you remember for the rest of your days. They put the pedals on her, and I never forget, at that time she shook up, said, "Dad," fell down, flat line again.
I can't imagine how it is to have your child in your arms that doesn't live anymore. I don't want to know how it feels. I'm very happy I wasn't there.
With such a severe form of the disease, Evelyn's reaction to Ajmaline was extreme, her survival bordering on miraculous. But even more chilling were Evelyn's own recollections of the day she went into multiple cardiac arrest, as her father remembers.
At evening we were sitting at a table with all of our family, and we were dining, and I still see the two oldest who could hardly eat, because at that time they were already